All right, everyone. I'm gonna start the conference now. So hopefully everyone's here by now. So hello, everyone. Welcome and thank you for attending the second annual Youth Cancer Health Conference. My name is Alicia Lin, one of the youth ambassadors, and I will be the host for the event. We also have Clara Chen, who will also be the co-host for most of the event. All right, so first I'd like to update you on some future events we have in store. So one of our future events is Wellness with the Stars, where you will have the opportunity to partner with us and host your own fitness activities. These can range from bike parties to Tai Chi and even getting to dance with some star performers. Feel free to contact us for more information. Oh, and please, next slide. So next, I would like to present one of our groups called ACS-YA Stop. The objectives of this group is to stand up against and raise awareness about tobacco for the youth. If you are interested in becoming a youth leader facilitator for the group, please contact us through the email below RSVP. And next slide, please. So welcome. The goals of today's conference is to advocate for public health change through training and participation, such as volunteering or donating, as well as aiming to prevent cancers through education and global support. By attending today's conference, you will gain access to knowledge and resources from expert speakers needed to take action yourself and spread cancer awareness and prevention. Next, please. So after we go over some housekeeping rules, we'll be presenting the highlights of our recent youth media contest. After that, a speaker from American Cancer Society will talk about their various health efforts and advocacy efforts. Next, we'll have our first panel regarding the importance of COVID-19 and Hpv vaccines for youth health. After that, we'll have some fun and interactive games hosted by our own youth ambassadors. Yay! Following that, we'll have our second panel about youth tobacco and cancer health prevention efforts. Later, you'll have the opportunity to learn about journeys into healthcare careers, and finally, a youth ambassador will present the various ACS-YA youth programs and tobacco cessation advocacy efforts organized in the past. So please stick around until the end for a special presentation regarding these. So next slide. Oh my God, I accidentally left. Okay, sorry, I think I accidentally left. Can everyone hear me?
Yes.
Okay, yeah, sorry about that. Okay, so housekeeping rules. So before we get started, I would like to go over some housekeeping rules. Okay, so please mute your microphone during the presentation and be mindful of background noise. We encourage you to turn on your camera to fully participate and position your camera properly. We'll record and take photos of the meeting and keep a record of the chat for our program awareness materials and social media. If during this meeting you would like to ask a question, please feel free to use the chat box or save your questions until the end. At the end of the training, we'll encourage you to complete a survey to let us know what you think about the meeting. So next slide, please. All right, so first we'd like to go over some of our amazing and talented submissions from the recent youth media contest. So, oh yeah, there it is. Also, I apologize for the, for the noise again.
Are thin, flat cells that form at the top of the epidermis. Basal cells, which are round cells under the squamous cells, and melanocytes, which are cells that give melanin and are found in the lower layer of the epidermis. Melanin is a pigment that gives skin its natural color. So what is it? Melanoma is a rare type of skin cancer and can occur anywhere on the skin. In men, melanoma is often found on the trunk, which is the area between the shoulder and the hips, or the head and neck. And
also, in addition to what's on our poster, one large difference between a normal blood cell and a leukemia blood cell is the cell growth, because is bad for the body because too many cell divisions allow cancer cells to take over the body and cause a weaker immune system.
And also, the main difference in our diagram between the normal blood cell and the leukemia cell are the amount of monocytes. And a high amount of monocytes leads to a higher risk of cancer forming in your body. And many studies have shown that monocytes are in fact the leading cause of leukemia in humans.
Because you have friends that can talk to you, and you can maintain a good health, which really will affect your life a lot. And yeah, that's it.
Single long skin incision to remove the prostate and nearby tissues. It is not very common today. There is also radical retropubic prostatectomy, where an incision is made in the lower abdomen. Radical perineal prostatectomy, where an incision is made in the perineum, and TURP, where the inner part of the prostate gland that surrounds the urethra is removed.
All right, so yeah, I was one of the screeners, so it was really cool to see all of those like submissions, and it's a fun experience too. So I highly encourage anyone watching this to join the next youth media contest. We have one every year, and you win some cool prizes and have it featured like today. So yeah, everyone give it up for our talented submissions. Next slide, please. All right, so next we have Mr. Dan Whistling. He's the Senior Executive Director at Los Angeles County of the American Cancer Society. Today, he will be presenting the programs and efforts of ACS. We also have cancer survivor Lillian, who has generously offered to share about her personal encounter with cancer and how she made her way to becoming a dedicated advocate and staff at the American Cancer Society. So is he here or? Oh yeah, and in the chat, yeah, check out our card. We have additional information or links to our social media profiles. We have a lot of great resources that you can use for your own benefit, and we also, of course, have a lot of events in store. Yeah, events. You can start the Dan's presentation and Lillian's as well after.
Hi, and thank you for participating today. We appreciate your involvement. My name is Dan Whistling. I'm the Senior Director. Hi, thank you for joining us today. My name is Dan Whistling. I'm the Senior Executive Director for American Cancer Society in the Los Angeles area. I wanted to speak with you a little bit to give you an update about how American Cancer Society has through the pandemic, some of the work that we've been doing, and certainly how important you are in the process. So with thank you, I'll share with you a little bit. As we know, it's been a very tumultuous time during the pandemic with severe impacts on public health. Individuals were not able to get screened for a long period of time and have had difficulty since. We estimate that more than 22 million missed a screening during the pandemic in 2020 alone. What this amounts to, as we know, the detection is the best time that we can really yield positive health results. The are detected with cancer, the harder it is to treat. This has been particularly dangerous for communities that have disproportionate impacts, whether, as we know, zip code is more important than genetic code in terms of your cancer risk and risk of mortality. There are definite disparities. African-American women, for example, have a higher mortality rate in breast cancer than comparable women. And this is due to a number of other factors at play that American Cancer Society is trying to address. Another crisis that has emerged through the pandemic is that of the uninsured. A lot of people lost jobs, or the nature of their jobs changed. The gig economy and things that are now more common are actually working against people unless they have taken part in some things such as the Affordable Care Act to ensure that they have continued insurance. This is again something the American Cancer Society is working hard with you to help on an advocacy level and in a community level. The way that we approach our mission in the very close civic partners and others to make sure that we can have positive health impact and health outcomes in local communities. There are a lot of factors that we're trying to address and overcome in the process. Even things like mental health can have tremendous impacts on a person's livelihood, their family, and so many other contributing factors that make it difficult, barriers to care, barriers to access. And these are all reasons why American Cancer Society is working extensively in terms of research and action locally. Different types of partners that we work with include federally qualified health centers. These are often the clinics that are in communities that have the lowest income, the highest number of people that are on Medicare, Medi-Cal. We work extensively with hospitals to provide the guidelines for when people need to be screened, men, women, youth. Things like the Hpv vaccine all need to take place through hospitals and health clinics. We work with numerous health plans to make sure that there's insurance available, all types of coalitions and statewide partners. We're working very closely with new partners or stronger relationships with partners, such as our recent example right now with NAACP, trying to ensure that more people do get vaccinated and that screenings and early detection takes place. We are a convener, we are an outreach organization, we guide messaging, we advocate, we are your partner in community. There are a number of programs that we also have been providing and continue to do so. Road to Recovery, for example, was a volunteer-based program that we have been providing up until the pandemic when we were unable to do so. And we're proud to announce a partnership working with the LA County Paratransit, where just in the past few months, we've been able to provide 1,500 rides alone. I want to thank you, because at the end of the day, the reason why we're able to do what we do and will continue to do so is because of you, your ideas, your strength, your compassion, your generosity, and your hope. Please do what you do. Please continue to be a partner with us. Please help us grow our partnerships and grow our impact in community. I want to thank you so much for your time. Thank you for being a part of a glorious mission where we will save lives, celebrate lives, and lead the fight for a world without cancer. Thank you.
All right, that was a great presentation. Now we'll be watching a video from cancer survivor Lillian. Please be on hold as we prepare the video. Thank you very much.
So I will never forget the day that I was going to pick out a prom dress with my mom and my sister, and we were in the car. And my sister said something silly to me, and I turned around to kind of give her a playful tap, and I felt a huge lump in my neck. Funny enough, it was almost my 18th birthday, and my uncle is a doctor, and he came over for my 18th birthday party, and he felt my neck. And I guess he went home later that night and told my aunt that I had cancer. And I was diagnosed with Hodgkin's disease. I was stage 3. It was along my lymph nodes, but I had no symptoms. If I would not have found that lump, it's probable that the outcome could have been much worse for me. So at my 18th birthday, I was diagnosed. A month later, I had started chemo. I was on 6 months of chemo. I would go once every 2 weeks for my treatment. You know, those 6 months were pretty intense for me. And then after it was over, I just had follow-up appointments and scans. Appointments and scans for the next 5 years. The year after I was diagnosed, so I was 1 year post-treatment, somebody from ACS had gotten my name, probably from a cancer registrar, and they called and said, hey, we know that you're a survivor. Do you want to come and do this thing called Relay for Life? When I did that first relay, it just changed my life. I found hope. I talked to other survivors. I found my purpose, and I just decided then that I needed to do more to promote cancer awareness, to help people that were my age and going through any kind of diagnosis. After college, somebody from ACS called me and said, hey, you are one of the highest fundraisers. We have a job opening. Do you want to come and work for us? And I jumped at the chance, because what better way to help other people than if I work for an organization that does everything they can for those people who are in treatment, post-treatment, and those that have yet to be diagnosed. You know, because of the treatments that I had, I'm able to stand here today, you know, 20 some years later and be a survivor and have a healthy life. And that, you know, if we don't keep working hard and raising money for research, then you know, then someday a 17-year-old might not have the chance to live a full and happy life like I've been given.
All right, that was a very moving story. I guess it goes to show how important this research is for even someone as young as 17 years old, huh? So I'm very glad she shared that story with us. So thank you to Dan and Lei for sharing their experiences and ways to advocate for cancer prevention. I will now pass it on to Sophia, Ling, and Brianna, the 3 co-chairs of this conference. They will present the ACS Youth Ambassador Program, their efforts in the community, and the youth experience with participating and organizing these events. And with that, I'll sign off. So thank you very much, everyone. And I hope you enjoy the rest of the conference. After this, Claire will take over for me. Thank you.
Wait, Evan, can you go back to the previous slide? Thank you.
Okay, so shall I go first or someone else go first? This is Ling.
You can
Ling,
go
please.
first.
Okay, okay. Thank you. This is Ling Wu. I'm an American Cancer Society volunteer since year 2020, and I first joined Relay for Life. Now you can see I'm wearing a Relay for Life shirt from 2013. So I've been doing Relay for Life ever since. And in 2021, in 2010, we started Chinese Relay for Life because we found there's no Chinese speaking volunteer for American Cancer Society. So in Relay for Life, we also work with youth to develop their leadership and hope to teach them about cancer awareness so that they can carry to their home, to their school. They can communicate to their parents, grandparents, and their peers. So during this period, we learned that teaching them the knowledge by stuffing duck is not efficient. It doesn't really work. So we developed the youth multimedia contest. It's been probably 5 years. We found it very effective because we found if we ask the youth to come up with a subject, a project, and then do the research and do the work, produce either a poster or a video, and then come to the contest to present it so they can communicate what they learned. This knowledge will stay with them. And so it has been quite successful. It has grown. And this year, we're happy to report we have about 30 teams. We have teams from Taiwan, from Texas, from New York, etc. So we're really happy about it. And so when we were doing this youth multimedia contest, we also asked the youth to help us to run the events, to put the event together, to fundraise, to do the Zoom when it's pandemic, and to do the video, to help us with presentation and setting up the site and things like that. And we found a great group of volunteers, very motivated. And then after the event, then they will ask, what else can we do for American Cancer Society? So, after doing this for a while, because, we really want to be good to the youth. We want to make sure we have enough volunteer power to work with the youth. But finally, last year, because of pandemic, we started the first youth conference since they are very available at home, and it was very successful. We addressed vaping and childhood cancer. So this is our second year. And in between, we found so many youth volunteers and also the parents would like the youth to be more engaged with American Cancer Society. So we started the Youth Ambassador Program. So the purpose is to keep them engaged and give them meaningful volunteer opportunity. Then we also offer them the benefit of volunteer hours, and they'll learn different knowledge skills, social media, publicity, doing the event, like Brianna and like Alicia. We have really wonderful, Dimitri, you'll see, some of our volunteers later. So they have developed over the time to be more responsible and to have more skills, of course, to be knowledgeable of American Cancer Society mission. So eventually they'll go out and benefit the community, their family, and by peer-to-peer communication benefit their peers, which is a very tough crowd for us to reach as adults. So now you can see that this is a good program, and we need to work with motivated youth who are willing to serve. It's not a game. I mean, it can be fun by working with teams, with working with their peers. And, and of course we do a performance. We also have, like Kahoot games by Ryan. It can be fun, but mostly we are gearing toward youth who will learn how to serve. You're willing to serve. You're willing to work with the team. And but we'll give you benefits. And, we'll give you, besides ours, sometimes, if a youth is really doing a lot of volunteer work, sometimes we'll write recommendation letters, apply for presidential award and things like that. But it all depends on the youth. Now, of course, the parents who work with the youth to help them to be successful. So if you are one of that, or if you know one of that, let us know, communicate with us. And we love to work with you. And we'll develop program as we go to see, what program can benefit people more. Bad programs will not do it anymore. We're still in the developing stage, and we started at the end of last year, but we already see a lot of interest now. So we welcome you to join us, but please be willing to serve. Thank you very much.
Hi, good afternoon, everyone. And I'm Sophia Young. I work at City of Hope, and I'm a cancer survivor myself. I'm a volunteer and an advocate for American Cancer Society for over 10 years. I'm very honored to have the opportunity to help with the annual cancer health virtual conference and then serve as a youth advisor of the ACS Youth Cancer Health Ambassador Program. I'm also co-hosting the City of Hope and American Cancer Society Chinese American Cancer Support Group every month. I would like to take this opportunity to thank American Cancer Society City of Hope, the CGI Tobacco Cessation Program, and also the Asian Pacific Community Resource Group for all their continuous support for this program. I'd like to thank Ling and also Joanna for organizing this program and asking me to join the effort. And I've learned so much by serving the community and work with the youth. And I found my purpose and award. And so thank you for all the speakers and the support, and also especially for all the youth from every one of you. And we hope to see you in an upcoming ACS event and activity. I pass it to Brianna, our co-chair.
Thank you, Sophia. Hi, everyone. My name is Brianna Lee. I'm also one of the co-chairs. Working with the Youth Conference Planning Committee has been a humbling and exciting experience. We were able to not only learn about the prevalent issues regarding cancer health, vaccinations, and tobacco control, but we're also able to build a community where we have a common goal of making our world a healthier place. And I really encourage you to join our Youth Ambassador Program if you'd also like to grow and make an impact on our community. So moving on to the next slide, I will introduce our first panel. So I'll be the youth moderator for that. And our first panel is about why COVID-19 and Hpv vaccines are important for youth health. So today our panels include Dr. Jeffrey D. Klausner, Dr. Martinez-Poulin, and Ms. Lin. Dr. Klausner is a professor of Population and Public Health Sciences and Medicine at USC. He currently directs a clinical research lab and serves as PI on several NIH-funded clinical research studies on STI testing and prevention globally. Dr. Klausner has a particular interest in the use of technology to facilitate access to treatment for disadvantaged populations. If you can go to the next slide, it has his bio. Yes, and then our next panelist is Dr. Maria Martinez-Poulin, who is the Deputy Superintendent of Los Angeles County Office of Education, the nation's largest regional education agency. She has served in the public education for 31 years and is a champion of equity and access. Dr. Martinez-Poulin earned her doctorate degree from USC, where she conducted research on mentoring and leadership. She has been recognized for her service and dedication with the 57th Assembly District, the 2021 Distinguished Women of the Year Award, honoring resilience and excellence for her work during the pandemic to support students and staff. And last but definitely not the least, we have Ms. Irene Lin, who is an enthusiastic volunteer in the education of schools and community after retiring from the advertising industry to be a full-time mom. She was a former member of the Friends of Arcadia Library Foundation and is the advisor for Gifted and Outreach Research. Now I'll pass it on to Dr. Klausner, who will be starting us off with a 15-minute presentation on pandemics and public health.
Great. Well, I'm very excited to be here with you all today. So let me see if I could successfully share my screen. Let's see here. So do we have the right slideshow here?
Yes, we can see it.
Okay, you can see the full slides?
Mm-hmm.
Great, okay. So thank you all for inviting me. I'm gonna just give about a 10 to 15 minute update on COVID-19 and HPV cancer vaccination with a bit of historical context. Prior to being at USC, I was at UCLA for 10 years as a professor of medicine and infectious diseases. And then prior to that, I worked for the CDC in South Africa and the CDC and San Francisco Department of Public Health for about 15 years. So I have a long history working on the ground in public health and now I do public health research and teach in public health. So vaccination was actually first discovered, if you will, in the modern way in May 1976, where Jenner used a lesion from a cowpox infection to inoculate an 8-year-old boy to prevent him from getting smallpox. It actually had been known for 1,000 years or more that people who had survived smallpox were immune from repeat infection. And that's actually a critical kind of observation in terms of our understanding of how vaccine works, is that people who successfully recover from a viral infection like smallpox or now COVID-19 are immune and protected from further infection or repeat infection or serious disease. So Jenner knew about this, and as a scientist at the time, he did the first experiment in humans, essentially, where there was a milkmaid named Sarah Nelms who had cowpox. So she had lesions on her hand. He took a sample of this lesion and he administered this kind of lesion sample to this young boy. And then about 2 months later, he challenged that young boy with smallpox, and the young boy did not get infected. And that was the first demonstration of vaccination. And the word vaccine actually comes from Latin word vacca, or cow. Now, since smallpox was first used as vaccination as early as 1898 was when it was commercialized and developed, there's been kind of a steady success for vaccines against other viral infections. So yellow fever, and now no one really knows about yellow fever. We don't see cases of yellow fever. Yellow fever is eliminated in most countries around the world. There are still some outbreaks of yellow fever, particularly in some of the Amazon areas or in Central Africa. Influenza vaccine was first implemented in 1945, and as we all know, that's an annual vaccine that changes as the influenza virus mutates from one year to the next. Polio vaccine was first identified in early 1950s, and now polio has been eliminated from all major continents, is on the verge of eradication, which essentially means when a disease has been eradicated, it's no longer on planet Earth. So smallpox has been eradicated. There are no more human cases of smallpox since the early 1990s. Measles also has been eliminated from many countries around the world. It's a routine childhood vaccine. Mumps. So I was actually born in 1964, so mumps vaccine came out in 1967. Now is a routine childhood vaccine. Rubella as well in 1969. Those are now combined into one single shot called MMR vaccine. Hepatitis B in 1981. Hepatitis B is a routine infant vaccine in the United States. So every newborn gets a hepatitis B vaccine at birth, and then on several additional shots thereafter. And now hepatitis B, which had been a major cause of liver cancer. And our first kind of understanding that viruses can cause cancer was through hepatitis B. So hepatitis B related liver cancer is still an issue in many parts of the world, particularly in Asian countries, but it could be potentially eliminated by universal worldwide vaccination against hepatitis B, which is increasing vaccination, but we're really not there yet. Chickenpox or varicella virus was approved in 1995. Shingles, which is an adult form of varicella vaccine, approved in 2006. HPV, which I'll be talking more about, human papillomavirus. So that's really our second cancer vaccine after hepatitis B. And it's important when we think about our successes in the quote war against cancer that we actually have cancer preventing vaccines like hepatitis B and human papillomavirus. And then I'll also cover SARS-CoV-2 or the COVID vaccination with a focus on children. So HPV vaccination, it is safe, efficacious, which means it works well in clinical trials, and it's effective, which means it works well at the population level. So these are data from the United Kingdom that show the changes in the frequency of 20-year-old women who are diagnosed with a precancerous lesion of the cervix. So you can see that women who were born in 1988, about 1 to 2% would be diagnosed with a precancerous lesion of the cervix. And then women born in 1995, so only 7 years later, that dramatically drops. And that is a direct result of the success of the HPV vaccination implementation in young women in the United Kingdom. But HPV as a cause of cervical cancer is actually only the tip of the iceberg. There are several other HPV-related cancers that people may not often think about. There's oral pharyngeal cancer, which is cancer of the tissue in the back of the mouth. And actually, in California, oral pharyngeal cancer is now more common than cervical cancer, and it's more common in men than in women. So HPV vaccine, which has not been, does not have the same frequency of uptake in young boys and young girls, is a big missed opportunity to prevent oral pharyngeal cancer later on in life. Anal cancer is also caused by HPV. So HPV cancer vaccine can prevent anal cancer. There are cancers of the female genital tract outside of the cervix, on the vulvar or inside the vagina, which are also caused by HPV, which can be prevented by HPV cancer vaccination. And then penile cancer, which is rare, but that's another HPV related cancer. And then when we look at these other cancers, you can see there's over 14,000 cancers of the oral pharynx, the mouth, back of the mouth, the throat in the United States, 6,000 anal cancers, 3,500 vulvar and vaginal cancers. And as I mentioned, penile cancers are relatively rare. But it's important information as we think about how to promote the HPV cancer vaccine, to remind people that it's not just cervical cancer this will prevent, but other cancers as well. So, part of my work is to do research, and actually do research with students, typically university students. So on the left, this is a research article where we looked at the excess number of cancer cases and the cost of treating those cancer cases due to the suboptimal vaccination coverage in California. So right now, depending on what data set you look at, about 55% of California adolescents have received the completion of the HPV vaccination. 55%. So that to me is far too low, and we should be doing much, much better to prevent these cancers and prevent the cost from the cancer. So when we looked at that, we actually saw that there were over 1,000 preventable cancers occurring every year that could be completely avoided if the vaccination rate was above 95%, which is the typical vaccination rate that we see among childhood vaccines for things like MMR or tetanus or diphtheria vaccines. And then additionally, this continues to have costs to the health system, costs for treatment, and costs for managing cases, and also potentially preventable deaths as well. So that's a big missed opportunity. And it's these kind of data that then we can take to policymakers at the state to try to make bigger investments in HPV vaccination. Now, one of the best investments in HPV vaccination is actually shown on the right. So we looked across the United States at what states have requirements for HPV vaccination for school entry. And those are states like Virginia, like Rhode Island. And in those states, you can't go to 7th grade without showing evidence that you've been vaccinated against HPV, which is, similar to other vaccines that are required for school. And we saw a very strong correlation between states that had the vaccine requirement and higher levels of vaccination coverage, cancer prevention, and reduced number of cancer cases than in states that did not have the school requirement. So we've been advocating for several years now that every state and every school district should require HPV vaccination for 7th grade school entry. It's been actually a little bit difficult to gain a lot of traction, however, in the community. And this is definitely an area where young people, where teen health advocates, where youth advocates, particularly those advocates who want to prevent cancer, could make a difference. So those students could work in their school districts. They could advocate for requiring HPV vaccination for school entry. So as part of that, my group has put out a call for action to demand school districts require HPV vaccination. And that could be something certainly the American Cancer Society could take a role in. Actually, to date, the American Cancer Society has been neutral on requiring HPV cancer vaccination for school entry. And then a second key aspect that we've been working on is education for teens about vaccination rights. So there's a wonderful website called Vaccine, and that was founded by a young woman who used to work for me here in Los Angeles. And Kelly Daniper, she'll be now starting her first year, or she started her first year at Stanford. But the Vaccine website is an amazing resource. It's a national resource for teenagers to learn what vaccines they should be getting, how they can access their vaccines. In many states, teenagers 12 years and up are allowed to go to clinics, or allowed to request vaccines without parental permission, particularly vaccines that might be related to sexual reproductive health, like HPV. That's not going to be universal in terms of every state in the United States, but states like California, that certainly would be quite relevant. And that's another policy area where young people could work toward making sure that every teen in every state has a right to vaccination. All right, I'm going to transition to COVID-19 vaccination. So as people may know, there are 3 FDA authorized vaccinations for youth. There's one that's FDA approved, the Pfizer vaccine. So the Pfizer vaccine is FDA authorized for 12 to 15 years of age. It's FDA approved for 16 years and older. There's a subtle difference between authorization and approval. Approval is a little bit higher bar, requires more data, and requires that it's provided at no cost by health insurance companies. Moderna is also authorized, but for age 18 years and older, and the J&J single dose vaccine is authorized for 18 years and older. And all 3 of these vaccines are shown to be very safe and highly effective in these age groups. As people may know, there are studies underway to look at the effectiveness and safety in under 12. So from 5 to 12 years old, and then under 5, we're expecting that those studies will be submitted to the FDA by as early as the end of this month. But it's going to take the FDA at least 3 months to authorize an under 12 vaccine. And one of the reasons why it takes a long time is because the frequency of serious adverse outcomes due to COVID-19 in those under 17 is actually quite rare. So since the beginning of the pandemic, there's only been 35 deaths in children in the state of California. So that's about 1 to 2 deaths a month. So obviously every death is devastating to that family, but from a public health perspective, 35 deaths in children, among 67,000 deaths in California overall, means about 1 in 2,000 deaths are in children. So when 1 in 2,000 deaths are in children, that means, the important outcomes that we look at in vaccination studies, like severe illness or hospitalization or being in the ICU or dying, are quite rare, which means that the studies have to be very large. The studies take a long time, and often we have to use intermediate outcomes to, have adequate evidence to show that the potential risks of the vaccine are balanced versus the benefits of the vaccine. And that's actually why for vaccinations in teens, there's been some controversy, right? So people who've been following this in the media may be aware there's been some controversy around the side effects. So side effects such as inflammation of the heart or myocarditis. So while it's rare and may occur in anywhere from a couple in 100,000 children who get vaccinated, it can lead to hospitalization. But the encouraging thing is that all these cases of myocarditis have resolved, that people left the hospital, they were not particularly serious, and they were readily treated. And that's the main side effect that most physicians have been concerned about. But then the other side of the coin is the benefit. So if you remember, the benefit of the vaccine has to be balanced against the side effects or adverse effect. And that in older adults is very clear, because the benefit prevents hospitalization, going to the intensive care unit, and dying. But for children, it's less clear, and the benefit is less strong. And now we also know with the current Delta variant that the vaccines are not as effective as we thought in preventing infection. They remain highly effective at preventing hospitalization, intensive care unit, and death, but less effective against preventing infection. So again, that benefit is not as strong, and particularly in children. So it's that benefit risk balance that provides some of the controversy and why vaccines are not immediately implemented for those particularly under 12. And then there's controversies against school requirements. If we can't get school requirements for things that are safe, highly effective at preventing cancer like HPV, imagine, school requirements for something like COVID-19, where the benefit may not be as dramatic or as certain. And I already mentioned some of these issues around transmission or the spread of infection. But vaccines do provide an important tool in that layer of our response to COVID-19 vaccination. So vaccines are one layer, in addition to masking, in addition to ventilation, and in addition to distancing. All these things add up to provide this layer of protection. So in summary, vaccination throughout history actually has been the key public health intervention to control disease, save lives, and extend life expectancy. So in countries that do not have very robust vaccination programs, they do not achieve the same extensions in life expectancy as other countries. Vaccination is safe, it's highly effective. However, controversies remain among physicians and scientists about that balance between the risk benefit and the value of mandates. And then it's important to consider that the ethics of public health are actually different than the ethics of medicine. So a doctor who sees a patient is going to have a difficult ethical balance in terms of they want to do the best for that patient, but ultimately not harm that patient. Whereas in public health, when we're thinking about the health of the whole population, we want to protect and assure the overall health and best outcomes for the most people in that population. But if there's, some adverse effect on an individual level, that's accepted. That's accepted as, a legitimate ethical contribution, because overwhelmingly the health of the community will benefit versus the potential side effects to a couple individuals. So the ethics are different, and that often makes the discussion difficult, particularly in the media. So I'm going to stop there, and then I'll be available for questions as part of the panel. So thank you very much for this opportunity.
Thank you so much, Dr. Klausner. That was very informative and intriguing to learn about the history and the importance of HPV and COVID vaccines. Now I'll pass it on to Dr. Maria Martinez-Poulin, who will give a 15-minute presentation titled, "You Miss 100% of the Shots You Don't Take."
Thank you for this opportunity. So happy to be here with you. So I have a quick question. Brianna, am I casting my screen, or do you have the copy of the presentation?
I do not have a copy of the presentation, so you can share your screen.
Okay, let me give it a shot. We'll see how skilled I am at this. Okay. All right. Are we good? Can you see?
Yes, it's perfect. Thank you.
Okay, and I'm trying to move into presentation mode, but I don't know that I'm there yet.
On the top right, it says present. Yep.
Excellent. Thank you for that. I'm trying to minimize here. Again, thank you for this wonderful opportunity to speak with all of you. It's just impressive, and I'm deeply humbled by the amount of information and great leadership with everyone here. So I will, get started. And it's important for us at the Los Angeles County Department of Education to really share the importance of having education and having information up front. And so for us, it was really about, you miss 100% of the shots you don't take. And following up on the presentation we just heard, I hope you can appreciate that title as well. Let's see, so moving on. I'm sorry, I'm working on my laptop and I don't see the arrows to move forward. Okay, so for us, it's about safety first. So we recognize that schools are a place where students must feel safe, supported, and respected. And during these very challenging times, we recognize that this is one of the most challenging times, and that for all of us, it is a historic moment. And we know that not only do we have the pandemic, a health crisis, but we are also living through a time where many of our families in our schools are living through health and food insecurity. Many of our families have lost employment. Many of our families are also very concerned about some of the social unrest that has happened here in the United States. And so there's a lot that is going on in addition to the pandemic. And so for us, it's about physical, emotional, mental well-being, all of that, which is so crucial and important if we're to develop an environment that is conducive and essential to learning. And so we strive to develop preventative strategies that are critical to maintaining safe environments at school, such as threat assessment, school climate, emergency planning, and health protocols. And so for us, we want to make sure that families know that vaccines have been around for a long time, and usually we talk about vaccines and we talk about have children had the necessary vaccination and immunization shots at the beginning of the school year when they enroll or when they move from one school district to another. We look at those immunization cards, and we're happy to know that many years ago, 30 years ago, only 7 diseases were covered with vaccinations, and now we have a lot more that we can add to that umbrella. But it's also important to know that without vaccines, children would be at a greater risk for serious illness, even disability and death. And when I think about my own my own mom, my aunts, my great aunts who have a slight scar on their arm from some of the vaccines that they had when they were young. And I think of my own vaccine, I don't have that scar. And it's because of the iteration, the evolvement of vaccines. And we have to recognize that at times vaccines are considered new and there is that fear, but they do get better over time. And we have to move forward and we have to trust in our preventative care. We have to trust our doctors and trust our school administrators. And we have to talk about prevention so that we can promote a healthier society and promote our children to have healthier lifespan so that they can do more. And so for us, it really is about lowering rates. And we see that as critical to vaccine preventable diseases and making sure that everyone has that opportunity. Now, historically, it's with COVID-19, but also it's with HPV. And I can tell you that I have a grown-up daughter. And when she was a young girl, we had that conversation. And I had to have that conversation with my own mom about, hey, there's this new vaccine that I'm considering for my daughter. And my mom was a little concerned about it, and we had to have that conversation. Ultimately, I did make the decision that I would have that vaccine administered to my daughter because I really saw it as an opportunity to prevent cancer down the road. And I wanted to give my child that opportunity. We also, at the time, I remember when I was teaching high school, the kids were getting the chickenpox vaccine, which is something that was new. And when I think of myself, I had the chickenpox at 16. And again, vaccines are something that help prevent and improve our quality of life so that we can have greater opportunities down the road. And as agencies of school, it's our opportunity to also provide and share that information so that our families can make those informed decisions. With COVID, it's really right now about providing multiple layers. And so with a strong partnership with the Los Angeles County Department of Public Health, our school districts determine the best way to reduce risk at school. And we know that one of the strongest and the most powerful layers that they can provide is to really make that decision for children that are 12 and older to get the vaccine. And we know that it's also important for adults to have that vaccine. And so we want to make sure that our staff and that families know that it's available to them. And then we provide for opportunities for staff to go during work hours, for children to have vaccine clinics at the school sites. And so again, that strong partnership, making it available and then sharing where other clinics are available so that they can have access to COVID-19 vaccine is important to us because we want everyone to know the availability and be able to make that decision. But we also provide symptom pre-screening tools, and we make sure that we are providing screening testing for families that have not yet made that decision to have the vaccine. Because we're in a moment where not everyone is mandated to have the vaccine, and we're in that period that, again, it's still not available to everyone, it's not mandated, and we're living in that time, we also make sure that everyone has clear signage on their campuses about protocols so that we're safe. We remind staff and students about masking, distancing, about ventilation, and good hand sanitation. And again, all of that is about making sure everyone is informed and they can take personal and community responsibility. So when we think about COVID-19 and we think about what it means for our children, for our staff, for our community, we know that fully vaccinated people are well protected from hospitalization and continue to be very unlikely to die from COVID-19. So we want to make sure that that information is made available to our community, and we want to make sure that everyone plans ahead so that they have the 2 weeks that they need to plan for events as Long Beach, Los Angeles make also their decisions to say if you want to go to certain events, you now have to have your card. And so we want to make sure that everyone knows so that they can also move really about the community, but again, that it comes back to help. It comes back to feeling secure, feeling safe. And part of that is knowing that that it is something that is available and that there is great science behind it. And as emerging data has come forward, that it's something that we are keeping very close eyes on, and that we are sharing that information with our community. And we want them to know that that we value their questions, and that as we get information from the state, from the county, we bring it forward with them as well. So in LA County, we have a campaign that's called All In. Schools in Los Angeles are all in and providing all the necessary supports so that our children feel confident, so that they are courageous and they can become independent learners. And we want to make sure that we are providing our communities with that information and give them a voice for continuous communication and supports, and that they can come to us with questions, that they can feel that they are a part of the decision-making process, and that they know that it's a collective effort when it comes to ending the pandemic and when it comes to making decisions at the local districts, at the community level. And so for us, again, schools, districts, countywide offices of education, we value the opportunity to share information, to participate in town halls so that we can hear concerns, we can answer questions, and we can look for research and then share that and bring it forward. But it really is about making sure that our children are safe, that our staff are safe, and that health, when it comes to preventative measures, that they know that it's available. And we also recognize that peer-to-peer influencers are very important. And we recognize that when teenagers, when young adults feel confident in the vaccine, that they will go out there and share that information as well. And I apologize, my fonts seem to be off here. But that's it for my presentation. I don't know if now's the appropriate time for questions or if you will have questions later on.
Oh, thank you so much. We'll have a Q&A session right after the discussion. So you can, or people can ask questions in the chat right now and we can answer them later on. So thank you so much. That cleared up a lot of questions regarding the school system and vaccinations. So we'll now move on to the discussion. I prepared some questions that most people might have, so I can just read them off. So the first one is, what are some suggestions that you have? Oh, wait, sorry. The discussion would be with all of our panelists. So Dr. Maria Martinez, Dr. Klausner, and Ms. Irene Lin. So what are some suggestions that you guys have for the youth to bring awareness to vaccines amongst our peers? Anyone can just jump in.
I think.
Go ahead, Irene. Please.
Thank you. I think right now we have this American Cancer Society Youth Ambassador Program. I think if students can organize a club or the presentation and propose to school and then present to the student, and like Dr. Maria Martinez suggested, peer pressures is very important factors for teenagers. So, and teenagers usually accept the opinions and then the influence from peers. So if the student, the teenager can do presentation, and I think the more teenager will listen, yes.
I concur, Irene. Thank you for that. I think student to student contact is important as far as sharing that information and relaying that information. So having testimonials like we heard today about cancer survivors, being able to share that they were afraid and they went on and had the first and the second vaccine, or that they themselves, again, willing to share their own personal story, I think is crucial. And being able to walk through their thought process of why they were afraid. And we know that there are some communities that have less vaccine, that their rates of vaccination are lower than others. And I think it's very important for us to be specific and to go out there and make sure that we are providing a voice to everyone and then answering those questions, because it may be that they're going to hear things that we have not heard. Some people will say things to teenagers that they may not say to an adult. And that's okay if they bring it forward and get informed information so that they can make the right decision. And that to me is very, very important. I want them to have access to informed, medically research-driven information so that they are safe. And we need to keep our teenagers, we need to keep our young adults safe moving forward in COVID, because I believe that they are also now a significant number of patients that are being hospitalized. And I think it's crucial that we get them on board so that we can keep them safe and help them to develop healthy lives moving forward.
Yeah, so I mean, I think to me, the stories are more compelling than the data. So, brief TikToks and, Snapchats and other kind of social media tools that people can use to, help promote the safety of, vaccination and, their own experience going through it, any doubts they may have had, how they, moved through that, and then, showing that they get vaccinated, whether it be for, COVID-19, if they're, the eligible age, or, for HPV. But I think, organizing around the use of social media, and then people create their own websites potentially and have samples of what kind of social media. But social media is really a powerful tool that certainly the youth know how to use, and can be very effective.
For sure. Thank you all so much for the suggestion. Social media is a very great platform that we can all use. When you mentioned TikTok, I was just recalling some TikToks that have vaccination information and things to bring awareness, and those are very effective amongst the youth. The next question is, what is something you would tell someone who does not feel comfortable getting the vaccines? And this applies to both the youth and the adults, or the parents.
So, I mean, I actually do, vaccine counseling in my, clinical practice, and, everyone's got a little different concern. So the most important thing from a provider perspective, is to listen and to understand and to, validate. So, we don't challenge, but we try to understand, okay, some people are, concerned about, long-term side effects. Some people are concerned about the vaccine ingredients. Some people are concerned about, vaccine efficacy, or, will it work? So it's important to listen and understand what people's concerns are, and then, not overwhelm them with, a huge amount of information or facts, but, just try to, give kind of some short factual information, and then listen again. And then, actually I ask them to reflect and tell me back, what did I just say? And, some people, it'd be stressful, particularly with, youth and adolescents, and they'll be like, I don't know. I don't know what you just said. So then we go through it again. And, it takes time. And unfortunately, the adage is, a lot of pediatricians and, specialists don't have the time anymore to really, sit down and listen. But, that's, to me, is the most effective, is to spending the appropriate amount of time understanding what the individual's concerns are, and then providing, factual-based information.
Absolutely. I would say listening and knowing that it comes from a place of great concern and quite possibly fear. And I remember when the vaccine Pfizer and Moderna first came out, and we were providing it for the 65 and over, and then providing it for the education sector, 65 and over. And I want you to know that employees, were crying that they had that opportunity to get the vaccine. And then when we made it available to the majority of our staff in the education sector, they cried. And again, when it opened up to families, there were tears because it was something similar to getting that golden ticket in the Willy Wonka story. You won something, and because it was so scarce. But now I believe that the individuals who have not had the vaccine are the ones who are perhaps shedding tears of anxiety because they really are afraid. And I think we need to help them understand that vaccines haven't been around forever, that they are always considered new when they first come around. And it was great to see the presentation before mine that talked about all the different diseases that we have conquered. And whether we reach out to religious groups, to Rotary, let's partner and let's work across groups in society so that we can get the message across and share how it is safe and share how it is about protecting each other. And it is a collective responsibility that we have in keeping each other safe. And I think that's important to also, when we share the information, to share that we are providing that information from a place of caring, that we want to talk about it because we care about them. And that's why we keep bringing it back. So I would say just to establish those boundaries, we care about you. And as long as they're willing to talk about it, to keep making it a point of conversation.
Yes, thank you. Irene, is there anything that you would like to add?
My husband at first is very hesitant to take the vaccination for the COVID-19, but then I convinced him saying, all the governments, all the countries, they are fighting for required to get a vaccination. So I think, I told my husband, this is a proof that this is something that is effective. Otherwise, governments won't try so hard to obtain a vaccine. So my husband listened to me, so he takes the vaccine. So I think you need to do a lot of research and read all the news, and also, like Dr. Klausner say, reading some data, and then you can explain to people who has hesitation. Yes.
Yes, thank you so much. All of those are great suggestions. Listening, opening up to people, connecting with different organizations, and also knowing our facts, like what Irene said, so that we can say the right things and know our information. So that's great. The third question is, do you think more vaccines would be given if more people were given the proper education regarding the myths and truths of vaccines?
So, one thing we saw in this COVID-19 epidemic was a very strong relationship between educational attainment at a state level and vaccine uptake. So like the two states in the United States with the highest, population educational attainment, so the highest percentage of residents, with a college degree or that have completed high school, are Massachusetts and Vermont. And, those are small states. They're, generally in the middle or, a little bit, left-leaning states, but they had the highest amount of population level vaccination. And then you looked at the states that had the least amount of educational attainment, Mississippi, Arkansas, and they had the lowest amount of COVID-19. And the researchers looked at this, also controlled for, if they voted for one president or another, and education remained the strongest predictor of who accepted vaccination. So among physicians, 94% of all physicians in the United States are vaccinated. And you look at other, people with PhDs and other higher degrees, and certainly just educational attainment. So that tells me, that, education matters, but it's not just, education, okay, conceptual education or, aptitude and ability to, get all these degrees and success, but it's the knowledge, that people have. And I've worked in Africa for, 30 years, and it always, strikes me, many places around the world, which is relevant to the United States. I mean, how much do people really understand germ theory? That there's a germ, a microbe, something they can't see, and that causes different diseases. And why should people believe that? But if you've gone through an educational process, if you've been through 5th grade biology class and high school classes, I mean, you do learn about this scientific basis for what causes diseases. And then people start to understand, okay, well, this is how vaccines work, and this is why this may protect me. So I do think education, which is a little different than information itself, education does play a big role in people's vaccine uptake.
For sure. Thank you. Is there anything else that any of the other panelists would like to add?
I think we do need to be very active in busting the myths and making sure that we are providing, partnering with solid sources and helping our community to identify who's a solid and credible resource so that they know who to trust. And I think, again, partnering with schools, partnering with, it would be great if we could hear from some teenagers, from young adults, if they could identify who they consider to be trusted in their community, and we can partner with them so that, again, we can identify who they're going to trust and who they want to hear. And then to have someone, to have an agency that is solid and credible partner with them. Because I think it's important, just like we teach in high school English, cite your sources. It has to be a solid reference. And I think that's important too, especially when making a health-driven decision.
For sure. Thank you. Ms. Lin, anything?
Yes, I think education is the key. And also I think parents sometimes they listen to their students, their children. And if the school, so the children can at the same time, if they got the information from the school, and I think they can share with the parents. So this is another education. It's an education path along with the parents. Yes.
For sure. Thank you. All right. The next question is, do you think that the COVID and HPV vaccines may become a required vaccination among students? Similar to how some vaccines are already requirements?
So I can share where we currently stand in K-12, and right now it's a local decision. So each school district is allowed to make their decision for their community. And we only have 2 districts in Los Angeles that have moved forward for COVID-19 testing, vaccine. And so I think unless the state makes a decision to make it a mandate and have it be one of the required vaccines that we use to enroll children, again, if it continues to be local, it's going to be very, we're not going to see, it's going to be very irregular as far as how many districts move forward with it. And it's the same thing, I believe, for HPV. I think it needs to be state mandated so that we can look for it and then help to be a part of that agency that keeps our children safe. And so I would say until we get that momentum going, it's still a local decision.
For sure. We need to keep updated with the continuously changing information. Thank you so much for the information. We'll answer, or I'll go with some of the questions that people put in the chat. So Lucas asked, do you think that many more people are waiting for more advanced iteration of the vaccine?
So advanced iteration of the vaccine might be a vaccine with broader coverage against certain variants, or a vaccine that, produces a stronger immune response against infection. So I mean, I don't think so. I mean, I think, we're seeing, we have almost 3/4 of the population have taken at least one vaccine. We've seen, in some counties in California, 90% of the population have taken at least, one vaccine. So, I think that the strategy now is, and we're seeing this in Los Angeles County and LA City, we're expecting this as well, is that, vaccination is going to be your pass to get into restaurants, into movie theaters, into certain kind of, events. And, the idea there is that's going to hopefully motivate some of the people that, just didn't find a good reason to get vaccinated. And then also, many workplaces, first it was the hospitals, the university where I'm at, University of Southern California, UCLA, do require, vaccination for their staff, for their students. So the idea of vaccination requirements is increasing, and we're seeing more of that. So, and we've done studies in the population about what people's concerns are or barriers, and the idea of a more advanced vaccine has not come up that frequently. So I think, there's still the concern people have, do I really need this? I'm young and otherwise healthy. My risk is low. I'll get infected and I'll, get through it. So there's still that kind of individual thought that people don't really think about others and the benefit, if they get vaccinated, how they can protect others in their community. And that's, persistent through most places in the United States, right? We have a very individualistic society, so it's a challenge.
For sure. Thank you for your answer. All right. Due to time's sake, we'll be answering one more question, and then everyone else who has questions, I will put our email in the chat, and you may write the email or send us the email with your questions, and then we will forward them to our panelists. So the last question is from Jonathan. What kinds of young adults have an increased chance of getting heart inflammation after getting the vaccine?
It sounds like a medical question. Maybe I'll take that. So heart inflammation, the medical term is myocarditis. And any medical term you hear with itis, that means inflammation, like hepatitis, inflammation of the liver, arthritis, inflammation of the joints, meningitis, inflammation of the tissue around the brain. So myocarditis is inflammation of the tissue lining the heart or the heart muscle. So it looks like boys, males are at increased risk compared to females. And then it also looks like people are more likely to get it after their second shot than their first shot. And then among the age groups, because the vaccine hasn't been available for under 12, we don't really have a lot of data under 12 other than in the research studies. But between 12 and 18, it actually looks like 12 to 15 is a little bit higher than 16, 17, and 18, which kind of makes sense because older adults, 40, 50, ancient adults in the, late 50s, you don't see a lot of reports about heart inflammation. But the reassuring thing is the heart inflammation seems to be very short, transient, easily treated with things like Motrin or ibuprofen, and there have not been any severe consequences of that we've seen in the hospital, at least in California. So while it is certainly scary, it does not seem to be that severe or have any long-term consequences.
For sure. Thank you so much for all of your guys' questions and for your answer, Dr. Klausner, and the answers from Dr. Martinez-Poulin and Ms. Irene Lin. Those are all very informative and we really enjoyed listening. Now we'll be moving on. Oh, thank you again to our first panelist for joining us. We greatly appreciate it. And then if Evan can turn the slides back on, we have some resources that people can check out. So that's our HPV and COVID vaccine resources. We have it in several languages if you guys would like to check it out. That's the QR code if you guys want to scan it on your phone. I will also put the link in the chat right now, just in case for later. And yeah, that's it with me. And now I'll pass it on to Clara Chen, who is the second co-host for today's conference.
And next slide, please. Hi, everyone. I'm Claire, and I'm the second co-host of this event. So now we'll be moving on, and we'll be taking a fun break and enjoy some performances by our very talented youth. So first, we'll have a slow and soft song performed by Amber Lin. And next, we'll have a cool jazz song called Jazz the Fight, composed and performed by Dimitri Lin, dedicated for youth cancer patients and survivors. And last but not least, a upbeat song called Cancer Survivor, written by Dominic L. Smith of the Cancer Killer, a Relay for Life team. So I hope you enjoy the show and sit back. That was an amazing performance from Amber. Now we'll be moving on to Dimitri's performance. That was a wonderful performance by Dimitri. And if you're looking forward to more, then we'll be moving on to our final song called Cancer Survivor from Dominic.
Who made that beat, baby? Tony did it. Yeah. It's a black boy jovial. Everywhere I go, I see a cancer survivor. Everywhere I go, I see a cancer survivor. Run and tell your folks that you're a cancer survivor. sure you believe. Watch and see. Get up off your feet. Trust in God. Make sure you believe. Go, 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 yeah, go. Yeah. I see a cancer survivor. Everywhere I go, 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 go. I see a cancer survivor. Run and tell your folks, 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 folks that you're a cancer survivor. Let the people know, know that you're a cancer survivor. Yeah, yeah. Don't give up. Keep your head up high. You're gonna win this fight. Don't you say goodbye. Fulfill your dreams. Don't you cry. Dry your eyes. Keep on living life. Don't give up. Keep your head up high. You're gonna win this fight. Don't you say goodbye. Fulfill your dreams. Don't you cry. Dry your eyes. Keep on living life. Yeah, yeah. Turn up. Don't give up. You're gonna survive. Yeah, yeah. Yeah. Everywhere I go, 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 go. I see a cancer survivor. Everywhere I go, 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 go. I see a cancer survivor. Run and tell your folks, 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 folks that you're a cancer survivor. Let the people know that you're a cancer survivor. Yeah, yeah.
If you all know anybody that's currently going through that struggle, please, I beg you all to make them, no, not make them, but motivate them to hold on. Because they can do it. They can do it. All they gotta do is trust in God. He'll make a way. Yeah, yeah. Trust in God. He'll make a way. Yeah, yeah. Yeah, yeah. Just hold on. Hold on. Woo! Come on. Yeah. Everywhere I go, 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 go. I see a cancer survivor. Everywhere I go, 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 go. I see a cancer survivor. Run and tell your folks, 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 folks that you're a cancer survivor. Let the people know that you're a cancer survivor. Yeah, yeah.
Those are some really wonderful performances. And now we'll have some fun and games with Kahoot, organized by one of our youth ambassadors, Irene Lin. And I encourage you all to join this Kahoot because I'll let you guys on a little secret. There's a special prize if you win. So try to ace all of these questions.
Hi, can I get permission to share my screen?
all for the game.
Thank you guys for playing. That is it for the Kahoot team.
That's the winner of the Kahoot game. I really hope you were all entertained by that. And now we'll continue with our second panel, which is about youth tobacco and cancer prevention efforts. I'll pass it on to one of our youth moderators, Dimitri Lin, who will introduce our panelists.
Hi, I'm Dimitri Lin, and I'm truly honored to be here to be able to serve as the moderator of this panel. I've been working with the American Cancer Society for the past year or so, and I'm currently the subcommittee chair for the tobacco prevention cessation efforts in the American Cancer Society. Also, just to get this out of the way, I apologize if my connection is not the best. I'm currently in a dormitory, and as you know, a lot of dormitories don't exactly have the best Wi-Fi. So if I cut out any time or if I have a disconnect, if anything happens, I'll be right back. So right now we have Dr. Ashing, Dr. Hernandez, and Ms. Lin. I'd like to welcome all three of them into the discussion. So first off, we'll start off with a 15-minute presentation, 10-minute discussion, and a 15-minute Q&A. So can we have the next slide, or can we have the presentation? So first off, we have Dr. Kimlin Ashing. Dr. Kimlin Ashing is a professor and founding director of Center of Community Alliance for Research and Education at the City of Hope Medical Center. She received her doctorate in clinical psychology from the University of Colorado Boulder, and as an advocate and scientist, she's advancing population health sciences and practices. She's a population behavioral scientist working to develop and implement evidence-based, culturally, clinically, and community-responsive health improvement interventions. Her mission is to engage advocates and civil society and science to speed up and ensure the public benefit of biomedical research and advancements. Can we get the next slide? Okay. So next up, we have Mr. Mark Hernandez. So Mr. Mark Hernandez is a program coordinator of Tobacco Use Prevention and Education Unit within the Los Angeles County Office of Education. And this unit provides extensive technical assistance to districts and schools to prevent and or reduce student tobacco use and nicotine addiction. The TUP unit also provides ongoing professional training opportunities at no cost to build teachers, school, and district staff skills-based education on youth tobacco prevention strategies. Mr. Hernandez has his bachelor's degree in marketing from the California State University Fullerton and his master's in school leadership from the University of Southern California. And finally, with Ms. Irene Lin, I believe we already introduced her, but I also just like to take this time to thank her. And I really appreciate her. I really appreciate my mother for being here and willing to take the time out of her day to participate in this meeting, answer questions, and participate in the discussion. So thank you. So I believe right now is an excellent time to move on to the, So here's a QR code for tobacco prevention cessation resources. So if anybody needs any resources in tobacco prevention cessation, feel free to scan the QR link and you'll find plenty of resources in here. So I believe now will be an excellent time for us to move on to our presentation, led by Dr. Kimlin Ashing.
Good day. Thank you so much, Dimitri, for that kind introduction. I hope I'm sharing my screen. Yes.
I can see it. That's good. That's good. Excellent.
Are you still seeing it appropriately, or?
Yeah, no, it's fine. It's fine. See, examining
Okay.
vape shops. Yeah, I see.
Wonderful. Great. So I am so honored to be participating with my co-presenters in this session, and importantly, because it is youth-led. So it's important to see that we're in good hands in terms of addressing the health needs for our youth. And we're working under the leadership of our youth in this program. So I wanted to focus on tobacco. And as you've seen in some of the presentations before, and we're talking about cancer specifically, but other chronic illnesses. Tobacco delivers serious carcinogens that causes several cancers. In fact, it is the leading cause of cancer. And if we can control tobacco in this country, we would eradicate several cancers and reduce the risk for other chronic diseases, including cardiovascular disease. So US smoking is linked to 1 in 5 deaths. In California, even though we've done a great job of leading tobacco control, because we are such a populous state, we still have almost 3 million smokers, 2.8 million in fact. And of these, almost 200,000 are living in our neighborhood, in our San Gabriel Valley. So we do have a smoking challenge and concern, and it's important that in this youth conference, you're taking the time to address this huge health issue that is controllable. So although tobacco products overall has declined, electronic delivery system and cannabis products have flooded the marketplace, and they're specifically targeting the youth. Because the earlier you start, the longer you'd be addicted, and the more they will have a marketplace to sell their harmful, dangerous, carcinogenic products. With increased retailing of harmful tobacco and cannabis products, we must understand and respond to the societal determinants that influence uptake and use. So I wanted to present a little bit about adults first. So in terms of current smokers, we have high rates among Native American, Alaska Native population, among multiracial group, and we see high rates among those who are very low income, who have a disability, and who are gay, lesbian, bisexual, transgender community, as well as those with psychological distress and challenges. So there are specific marketing to those communities. We also see that there is variability in smoking by education level, with those who have highest education have lower rates of smoking, and those who have a GED or less tend to smoke at a higher rates. So there are tobacco vulnerable population, and the tobacco retailing and marketing knows that, and they specifically target these vulnerable populations. So now to shift to youth, and most of the work would present on the youth population. So any tobacco products, so these are high school students in the US, almost a third, 31.2% have used some tobacco product. E-cigarette, 27.5%, cigars, 7.6%. I was surprised by this, that's pretty high. Cigarettes, 5.8%. Smokeless tobacco, 4.8%, hashish and hookah, 3.4%. So we see that there is high use among tobacco products. And when we look at the data on the right showing alcohol, cigarettes, and marijuana use, what we see is that alcohol is declining. So that's a good thing. We're making some headway in that realm. Cigarettes are declining, but they're using alternative tobacco products. And that's what we see here with that sharp incline with e-cigarette use as well as marijuana use. So tobacco use status, I'm giving you lots of data, and this you can have, so you can use this in your own advocacy work with your schools and in your civic organizations. You can use this data. So this is more recent data in 2020. And I think partly because of the increased attention to the concerns with electronic delivery devices and E-Valley, which is specifically related to vaping, we saw a decline in e-cigarette use among youth, and also vaping marijuana. But I'll show you later that that's not cause to be to not have concerns, because marijuana use in terms of other delivery systems are certainly on the rise, especially in California. So among those who use e-cigs, almost 40% use it frequently. 22.5% use it daily. They're using the disposable means because the equipment in the initial is cheaper, but in the long run, it's a huge expense, not only economically, but health-wise. And because it can deliver high amounts of nicotine, there is a strong nicotine dependence for those who use e-cigarettes. And 8 out of 10 are using the flavored. And again, this is target marketing towards youth and also women, actually, in designing these flavored e-cigs. So we see that that it's very responsive to the marketing, and they spent millions and millions of dollars marketing youth, enlisting popular culture folks to market to youth. And we can see, so this is a little bit older, but a sharp decline from 2011 to 2014. But as the previous slide showed, there is some decline because of the illnesses that have been associated with vaping. So this is focused on our community, LA County. And as you can see that there are a little bit of slope in the trends across 7th, 9th, and 11th graders, but it seemed again to be back on the rise. And I find, been doing health research for 30 years, sometimes our memory is short. So with the surge of E-Valley, there was a decline. But as we lapse on the attention, and of course, we've been focusing on COVID and COVID vaccination and Hpv vaccination, critically important. But once we shift our attention, and this is why this is so important that your youth here are focusing on this, then you could also see a trend maybe in a surge of e-cigarette use. Kids have been under stress with COVID-19. They may be turning to substances, including e-cigs, including marijuana, to manage the stress. And we know that this is not adaptive behavior. It just leads to a downward spiral for more substance use. So again, the flavored products have been targeted to youth. That's what youth are using mostly. And shockingly, the youth are purchasing these e-cigarettes themselves from vape shops. So should not be allowed, but it's happening. So much attention needs to be placed on regulation, especially of these retailers. So marijuana use, surprisingly, very, very high in our area. So we see that there are some ethnic variability, but overall fairly high rates of use among our youth. And so the data on the left, I wanted to keep that in, even though it's a little bit older, but it presents the various ethnic groups. So you could see that there are some variability in marijuana use. But the table on the right, it's more recent data, and it shows that in our catchment area, meaning our local Los Angeles County, including San Gabriel Valley, that 53.7% of our youth have indicated that they have used marijuana in the last 30 days. California is also very high. We're higher than that of the US. So we have to pay attention to marijuana use among our youth in our neighborhoods, in our community, in our schools. So the triangulum, tobacco, marijuana, and e-cigarettes, that's what I said, and a downward spiral in terms of exposure and increasing use of substances to try to cope We know as a psychologist that it's not adaptive coping mechanism. It affects your grade, your school performance, your development, your brain is still developing. It affects all of these things, and it affects, long-term career, long-term health issues as well. I'm moving quickly because I know I have other speakers. So I wanted to present our internal study looking at geospatial analysis, and this really highlights the socioecological context, what we think of as neighborhood and community, and how that may be fostering tobacco use as well as marijuana use and exposure to substances. So we used geospatial mapping. We wanted to look at incidence of lung cancer, cardiovascular disease, incidence of mortality, and look at some of the sociological contexts. So we found a high correlation between the density of the vape shop, meaning the number of vape shops in your area, and of course, these poor health outcomes, which is increased lung cancer and increased cardiovascular disease. So this map is very busy, but it shows that the mean level of vape shops, so it was 7.93, but that included San Gabriel Valley. We also wanted to look at Antelope Valley. As you see later, it's a region of vulnerability, meaning that there are greater densities. 32 vape shops just in Lancaster alone. So that means for every mile, there's 1 or 2, and this is dedicated. So these are not like the 7-Eleven. I'm not advocating that they should be selling, or a gas station. These are dedicated establishments solely to sell tobacco-related products. And we see higher rates of smoking in those communities. So exposure, they're being bombarded by the retailing of these substances. So again, the region of vulnerability, we see that 18.6% smoking in that region, in the Antelope Valley, whereas nationally it's 13.7%. Higher electronic delivery system using, higher secondhand smoke. It's the only health service planning region in LA County where you see an upward trend and elevated death from the associated illnesses, which is lung cancer, COPD, and cardiovascular disease. And when we looked at our patients, because at City of Hope, where I am a professor, as Dimitri said, we wanted to look at the patients who are from our Antelope Valley clinic versus our local Duarte clinic. And our Duarte clinic and around, surrounding San Gabriel Valley, we see 3.8% of those who are cancer patients still continue to smoke. In the Antelope Valley, it's sad, but no surprise, because with the density of vape shop, 10% continue to smoke. So again, just to reiterate and present the data, increased lung cancer incidence, increased lung cancer mortality, increased cardiovascular mortality, and these are clearly related to the density of smoke and vape shops. And these areas also have higher density of ethnic minority, especially Blacks, African American, American Indian, Native American population in these areas. So target marketing in terms of medically vulnerable, medically underserved groups. So it suggests that we need some regulation around how this is marketed, including to vulnerable communities and minoritized population and vulnerable groups, including youth. So the disparities in tobacco retailing and population targeting should prompt tobacco control policy at the governmental community health center, tobacco industry, and retailing. And we need to all work together to halt this rising tobacco concern among youth. So again, highlighting the societal determinants, access, the community, education level, and these go along with other challenges in community in terms of green space, healthy food access, social justice issues. So the tobacco industry knows these vulnerable communities and they are targeting them. So again, just highlighting the societal determinants. You could use this in your sociology class at school, or your public health, or your social geography classes, looking at from social inequities, societal inequities, institutional inequities in terms of, education quality, healthcare quality, as well as living conditions. Again, the physical space, green space, availability of healthy foods, and that affects, risk behaviors. And of course, it affects your health outcomes, including your vulnerability to diseases and injury, and your overall lifespan in terms of mortality. So I wanted to present this, and it shows that we want to look at inequality in our society, see that the tree is bending to the left to the other child. And not only the tree is bending, but that side of the tree that faces that privileged child is also full of fruit. So that child is primed for success. Equality is saying, okay, there's an inequity here. Let's give them both the same ladder. But we see that the marginalized, minoritized child still can't reach the fruit. And still on his side of the neighborhood, the community, there are more vape shops, there's less food availability, the tree has less apples. So let's look at, equity, which is great. So let's give that child, that minoritized child, a taller ladder so they can reach the fruit. But still, that community still has all these vape shops. So we're giving them some tools, but it doesn't fix all the problems. And here we're talking about justice now. So where each child is given the opportunity to reach their full health and their full educational potential. So our work has been generously supported by the NCI C3I program. It's from the Cancer Moonshot, as well as the California Tobacco Research Program. And I give my thanks to Sophia, who also helped organize this project and leads our tobacco cessation program here at City of Hope. So thank you so much. I'll stop share, right? And we have some references for you that we could share. Thank you.
All right, thank you very much for your presentation. That's truly informative and very, very helpful. So I believe now, since we've been through a presentation, we can move on to the questions. So can you please get the questions on the screen? All right, thank you very much. Since I think we're running short on time, we'll only have time for 3 questions. So I think the best way we can do this is divide up the questions for one panelist per question. So I think after hearing the presentation, since you've shown us your expertise in public health, I believe that the first question will be excellent for Dr. Ashing. So I'd like to ask you, what are potential public health risks of nicotine use and particularly tobacco and e-cigarette use during this pandemic, given that's a respiratory disease?
Yeah, I think there are multiple vulnerabilities on the personal side for that individual. Of course, there's risks to cardiovascular disease, cancers of the head and neck, cancers of the lung, and as well as cervical and other types of cancers that we don't hear about. Also, in terms of peer pressure, so usually this can be highly contextualized in a social context. So you're being exposed to your own smoking, but also the secondhand smoke of your peers. The peer group who tend to be more users of alternative substances tend to be youth who have other kinds of challenges. So I see it as a cry for help in our youth community. And so I would implore you that if you have a friend group and you see your friends smoking, it's not a popular thing, it's not a cool thing, it's really a cry for help. And maybe if you can encourage them to, share some of this material that you have been, blessed with today, to share that with them, or, talk with your teachers without revealing names, maybe just start a support group or to start some interventions within your school, because it really is a cry for help on multiple levels.
Thank you very much for your perspective. And I believe that it's very, very crucial that we address the issues behind this epidemic, and not only seen as a surface level issue, but rather we need to dig deep into what's going on. And that's I think that's the only way to address these issues, is to see what the root of the problem is and work on that level in order to make sure that we're truly addressing the issue and not just treating the symptoms, or treating the disease instead of treating the symptoms. So now I think we can move on to the second question, which is, are schools sufficiently protecting our youth from this crisis? And how could some of their approaches be improved? And what kind of services, resources, and collaborations do you need? So I think Mr. Mark Hernandez, being an administrator in a school and having considerable experience in the educational world, I think he would be an excellent person to answer this question for us.
Wait, I'm sorry, Mark Hernandez couldn't come today, so could we possibly forward that question to him later on, and we can let the rest of our audience know the answer?
Well, I just want to share a little bit about that. Sorry that Mark can be here, but actually, tobacco control isn't always at a state level. Some parts of it, it's so complicated, and that's where we need your advocacy as parents, as teachers, because certain cities are more vulnerable because they allow tobacco shops to be even closer to the schools. So we need to have stronger regulations around the marketing of these and to protect our schools. So I'll stop.
Thank you very much.
Yes, I can contribute a little bit to this question. I think the vaping problem is really like an elephant in the room. And schools and administrators, they all aware of these issues, but then I don't think they really do anything really sufficient to stop this issue. Most of the action they take are more passive. Like many students, when they're in school, they mostly smoke in the bathrooms. So I understand right now many schools and teachers have the bathroom pass for students to prevent them to go to restrooms often. But then all those are too passive for my opinion. And I hope schools can have more educational program to address this issue, like the health issues and then the addiction problems. And also, vaping is really a gateway drugs. And like Dr. Yeung say, it is really connect to the future substance use like marijuana and later more hard drugs use. So I hope schools can do more to educate the students and also the parents, because my son has done some presentation to the parents in school about the vaping and then the various products. And all the parents later, after the presentation, told me they are like, it's a eye-opener for them because they are not aware of so many different devices. And then, yeah, so I think education is very important, especially for parents. And I think for this epidemic, it has to be working together, hand in hand for parents and the schools together to help our youth to stop this academic.
Thank you for that. I think it's excellently bringing this up. And it also, we talked about how a lot of these issues like vaping, substance abuse, tobacco use, they're all seen as taboos. So a lot of educational institutions, a lot of schools are very reluctant to talk about these things. So as a result, because of their reluctance and their reluctance to admit that they have this problem in the schools, a lot of times they don't necessarily devote the time, the research, and the resources they need to address these issues. So I think it's very valuable that not only does the school, but the community and the school work together to create a solution that can transcend the school and maybe work into the community as well. So thank you for that. That's a very good point. I think now, given our time constraint, we have time for one more question. So again, can I get the next slide? Thank you. So I think now we can ask, knowing that we've already gone over a lot of the ins and outs of this issue, I think it's very valuable that we ask if we think that we're well educated enough on the risks of tobacco and e-cigarette use, and are there currently enough programs to do this? And finally, I'd also add on to the discussion for parents. Do you think that there are barriers, and how can we get over these barriers of communication about these issues?
I think that's so critically important. Thanks for asking that, and the answer is no. I mean, I think we've already identified that, as Ms. Lin said, I mean, if you ask a parent how many kids are smoking in the last month, I bet they will severely underestimate. We found it's almost 54%. That means more than 1 in 2 child is using marijuana in our catchment area, in our neighborhood, in our schools. And so we have a serious problem on our hands because our kids have opportunity to have access to these drugs. They're thinking that it's, harmless, and it's not. We have not studied marijuana sufficiently because federal funding wouldn't allow it, but our kids, we have a state that has approved it and other states that have approved it, meaning that there's increased access to marijuana. And maybe it was for medical use or something like that, but now our youth are being targeted as a market by these retailers. And so we need stronger regulations. We need to advocate. We need to use our political will to write our legislators, to let them know that California is leading the country in marijuana use among kids. I mean, you cannot go to the beach anywhere in Southern California and not see kids just absolutely getting high anywhere in California. And they look so young, they look so little. I'm like, how could they, and doing it openly too. So there's this almost that peer acceptance. So we need to change the culture because it's seen as the thing to do. And it's not. And the dangers of early exposure. This is the first generation that has been so widely exposed to marijuana at such a young age. We don't even know the impact on the brain development because this is the first generation that is using so much, so widely. So a huge concern, and we need to look at our voting power and calling our legislators to really look at youth vulnerability, not only to marijuana, but other products that's been targeted to youth, including e-cigarettes and electronic delivery devices of nicotine and other substances, because they can mix their own in some of the equipment. So very, very much we need regulation.
Regarding to the question, what's the barrier and then how to identify and communicate with your kids? I think parents, we need to update. And we need to see, because right now, like for me, for example, this is e-cigarette. And then this is something you can attach to a computer, almost like a computer device. And parents need to update the information about what those devices look like. And also, you need to see your kids' behaviors, because a lot of time they are very anxious, and then you can see whether their behavior has changed, because all those substances will make them agitate, and sometimes you will see your children's behavior change by using all those substances. I think parents, we need to care and we need to observe our children, because school, the peer pressure is like really the biggest factor of this vaping epidemic, because peer pressures, and then also the internet influencers now making this like a cool lifestyle, and it's a healthy alternative, but those are not. So parents, you need to when your children are not in at home in school, you can go to their room to check, to maybe see there's some items that you don't understand and you don't know. Maybe you can check with other parents. And also, because right now, like this is oil. It's a THC oil. You can literally input into all the pots. So right now, if you see your kids are vaping, you say, okay, it's just nicotine, but maybe it's not, because right now you don't even know what they are vaping with. And I think that's the reason why the marijuana use has become so high, because nicotine is always from like 20, 30 years ago. It's a gateway drug. It's a habit informing. So then they will later transition to other substance. So I think parents, you need to communicate with your children and talk to them about the brain development, and then to their health. And also, I think at the same time, the youth advocate is so important here, because the teenager, they will only listen to teenager. And then if you present the facts to them, I think it's much more efficient than parents, teachers, police to communicate with kids. So I think the youth ambassador is so important, have the most important role here to stop the epidemic.
Thank you very much for that. I think you made some excellent points, but unfortunately, we might be running pretty short on time. So I think right now we can move on to our next section about exploring health careers with Dr. Lillian Soo. So I'm going to give it up to whoever's presenting next. And thank you very much to all of our presenters and all of our panelists. I hope you all have a very good day, and I really appreciate your time to be here. Thank you.
Yeah, I agree. That was a really informative discussion, as well as just a very important presentation. And so now we'll be moving on to our next guest speaker, Dr. Lyrian Soo, a prominent pulmonologist from Cedars-Sinai Medical Center. She received her undergraduate degree in biology from Columbia University and her medical degree from Ohio State University College of Medicine. Today, she'll be talking about how she got into the healthcare field and what motivated her to do what she does today. I will now pass it on to Dr. Soo.
Hello, hi. Can everyone hear me okay?
Yeah, we can hear you.
Okay, great. I'm just going to share my, oops. I'm going to share my screen. There we go. All right, so thank you for having me here today. I'm very excited to talk to everybody about healthcare careers. Can everyone see my screen okay? The slideshow? Yes, hopefully.
Yeah.
Okay, great. Yeah, I'm Lillian Soo. I am a pulmonary and critical care physician, meaning that I specialize in lungs and intensive care unit care. So yeah, I'm going to talk to you a little bit about healthcare careers. This is a picture of my son dressed as Doctor Who. He is a much cooler doctor than I am, but I guess he's also a type of doctor in a way. So pathway to becoming a doctor, I just wanted to kind of give a brief overview because not everyone necessarily knows all the steps in becoming a doctor. Obviously you have, you start off in college, you have your 4-year degree, which is usually a bachelor's degree. And the typical required courses would be physics, chemistry, organic chemistry, biology, and math. And then there are sometimes other required courses like psychology, sociology, English, and writing, depending on what medical school you're applying to. And that, speaking of writing, it just reminds me this was kind of a tough week because we had a breakdown in an electronic medical record, and we ended up having to do a lot of paper notes. And that reminded me of this joke: a wise doctor once wrote, and no one can read it, because that's kind of how my notes were, I feel, for some people this week. But I actually didn't know that I wanted to be a doctor when I was in college, and until like the very, very end, the very, very last year. And it just so happened that I had done many of the prerequisites, and then I went ahead and took the MCAT. The MCAT is basically an exam where they test kind of your knowledge on those required courses. And it's actually changed quite a bit since when I took it, but I guess there are 4 sections now that are a bit different from the sections that there were when I took the MCAT. But that is a standardized test that the medical schools look for. A lot of people do what we call a gap year. This is a year between college and medical school where you can kind of like, look at the things you're interested in and explore them further. If people are considering research, I would recommend that they consider finding a position in a lab doing the research that kind of interests you. So if you're interested in cancer research, you might want to find a cancer lab to try to work in so you can get an idea of whether or not that's something that really does appeal to you. I did a year of research. And I actually found that research was not a good fit for me. I think I'm better at bedside and in clinical work. But that was an important thing for me to find out. Some people spend their gap year volunteering in free clinics or hospitals. Some people work abroad because it's a time in your life where you may not have attachments that keep you from working abroad. There are people who work as a scribe. And that's like when you're following a doctor and typing out their notes for them. So you get some exposure to bedside care. Really anything you want to do to explore your interests, this picture that I have here is actually taken by me on a boat in the Solomon Islands, where we were going, we had just a ton of medical equipment on board, and we were going from port to port providing medical care. And, and I thought that was a good experience because that enabled me to see what medical care sometimes looks like in other countries. So again, this is not everyone does a gap year, but it might be a good year to explore some of your other interests. And then you go to medical school. This is a 4-year program typically, but it can be combined with other degrees. Some people do an MD PhD, which typically takes 8 years. Those are people who are interested in doing research usually. Some people do MD JDs, which is like a medical degree and a law degree, which takes 6 years. And those are people who are typically interested in forming healthcare policy, for instance. An MD MBA is a 5-year course, and a lot of people who want to become like hospital administrators might do that, or an MD MPH if you're interested in public health. I did a straight MD program. I didn't combine it with anything. And then there's this day called Match Day. Match Day is when every single, prior to Match Day, you interview for residencies. So every medical student has spent, like a month or 2 interviewing at different residency programs across the country sometimes. And they've made a list, like this is my top choice, this is my second choice, third choice, et cetera. On the flip side, the residency programs have also made a list of all the medical students they've interviewed and where they rank. This is the one we want the most, this is one we want the second most, et cetera, et cetera. And then it all goes into a computer program, which then prints out like basically a matches residencies to medical students. So on match day, every medical student gets like a white envelope. And at the same time, across the entire United States, they open that envelope, and that's when every medical student finds out where they matched for residency. And whatever it says in your envelope, it's where you're going. So it's a very exciting day for everybody. In terms of residency, when I chose my residency, I wasn't completely sure like what field I wanted to go into at that point. I liked, my mother is an OBGYN. I liked my OBGYN rotation, but in the end, I liked medicine more because it just, it had so many different organ systems involved. And so I ended up doing a residency in internal medicine. But of course, there are several different kinds of residencies, family medicine, pediatrics, and different residency programs can take different amounts of time. Internal medicine, for instance, is 3 years. Emergency medicines can be 3 to 4. Psychiatry is 4. Obstetrics and gynecology is 4 years. General surgery is 5 years. Most of the surgical residency tend to be 5 years or more. So after residency, you can choose to practice, which some of my colleagues did, or you can choose to specialize further in fellowship. So I did a fellowship in pulmonary and critical care. And that was mostly because when I did my residency program, I really liked being in the ICU. I found the ICU to be a really kind of fast-paced place where things happen. You have to like really be on your toes and, make sure that you're checking on things, very frequently, that kind of thing. So I kind of like the pace of the ICU. And so I applied for a fellowship in pulmonary and critical care because in the ICU, a lot of patients tend to be on ventilators, so it really helps to have that pulmonary portion so you understand what's going on with their lungs. And so I did pulmonary critical care. That was 3 years. Some people just do pulmonary, which I believe is 2 years, and some people just do critical care, which is just 2 years. But if you combine them, it's 3. And so that's what I did. I had friends go into other fields. These fellowships that I've listed are really all internal medicine fellowships you do after internal medicine. Of course, there are other fellowships you might do after surgery, like vascular surgery, or there are fellowships that you might do after obstetrics and gynecology, like maternal fetal medicine. So, the subspecialties that you choose really kind of depend on what it was that you did for residency. But yeah, that's, kind of, what I looked at. And then after you finish residency or after you finish fellowship, then it's time for you to, kind of choose a career, like, do you want to do clinical work? And I chose to do clinical work in academics and teaching. So I work for UCLA and a lot of my job is seeing patients, but part of my job is teaching medical students or residents or fellows. Like right now I'm teaching the second year UCLA medical students in a small group where we have them interview actors that are pretending to be patients, and they have to discuss like sensitive topics with these patients. Sometimes they have to like tell them bad news. Sometimes they have to discuss, sensitive topics like domestic violence. And it's a good way of them practicing how to talk to people about things that you don't necessarily talk to other people about before they actually have to see patients. Aside from academics and teaching, if you don't want to join a large academic institution, you can always go into private practice. Private practice, you can be a solo practitioner, meaning you're a doctor who works on their own, or you can join a group practice, which is several physicians who have banded together to make a practice. In private practice, you do have to think a little bit more about the business side of medicine, because you'll have to hire and fire staff. You'll have to, find a rental for a space for you to practice and things like that. And so, private practice, in addition to being a doctor, it's also kind of like running your own business. Some people choose to join large healthcare organizations like Kaiser or Providence, where you are an employee. So you provide medical care, but you don't have to really deal with as much about the business side because you are a paid employee. Sometimes you have more educational opportunities at some of those places. Sometimes you don't. It really kind of depends. And then another thing that really appeals to people sometimes is something we call locum tenens. Locum tenens is when you are basically taking on jobs that you want and not taking jobs that you don't. So places that might have a doctor who's out, say, on maternity leave might be looking for someone for 2 months in Oregon, and you can choose to take that job or you can choose not to. Or sometimes places like remote places like Alaska, they might not be able to find a physician who wants to be there the entire year, but they can find physicians who are willing to work 3 months at a time. And so for locum tenens jobs, you look at the job listing and it's like usually a short-term commitment, and you can choose to take that job or not. And then there are people who go into research. There are people who are in academics and research, and then there are people who do research in industry. And people who do research are the people who are coming up with like clinical trials. They are designing trials to see whether or not a medication or a device, works the way they want it to, for instance, and what side effects are people having to them. And sometimes they have to deal, with large studies that kind of span different countries, and you'll be working internationally with doctors in other countries because, they'll be giving an intervention that, they'll be participating in your study in another country. And so, you'll be doing kind of global collaborations. And then, people who might be in industry, doctors who might be in industry, then have to present these findings to the FDA. The FDA is a government organization, and they basically review research presented by other doctors and see whether or not they feel the design was study was designed well, and whether or not they feel the findings were, what the other doctors say the findings are, whether or not they agree with them. And they are also the people who might approve of new medications or approve of new devices, for instance. And so, those are different careers in medicine. And a few other things I asked people that I work with, or people, other doctors that I know, if there's anything they wish they had known when they before they became doctors. And one thing someone said, and I think a lot of people echo this sentiment, is one of the things you should find out is if there's anything other than medicine that will make you happy. Medicine is a long commitment, several years, and it takes a lot of time, and you'll be making sacrifices for a career in medicine. And so you just want to make sure that there isn't anything other than medicine that will make you happy. For instance, I had a classmate in my, in medical school who he finished medical school with us, but then he decided that medicine did not make him happy, and he went to grad school, for engineering, and now he's like an engineer with like a government organization, and he's extremely happy, and he didn't end up doing medicine at all. And that's okay, whatever makes you happy. It doesn't have to be medicine. It can be many, many other things. And I would say take the time you need to explore other interests. There were people in my medical school class who, there was a woman in my medical school class who used to be a high school teacher, and she was a high school teacher for maybe 10, 20 years. So by the time she joined us in our medical school class, she was in her 40s. And, but then by that point, she was sure she wanted to have a career in medicine. So, there's always a potential to, make that change at a later date. In terms of choosing a certain field or or a certain subspecialty of medicine. Sometimes it's what interests you, are you interested in, procedures? Are you interested in, conversations with patients? And that will weigh into your decision into your decision as to what specialty appeals to you more than another. And the other thing that I think more and more physicians are considering is lifestyle choices. So part of the reason I chose pulmonary critical care is because a lot of pulmonary critical care practices are run in a shift schedule. So because the ICU needs to be covered 24 hours a day. So someone might work from like 7 a.m. to 7 p.m. and then someone else may take over from 7 p.m. to 7 a.m. And so because they're on shift schedules, when you're on, you're on, when you're off, you're off. And that was very appealing to me because I knew I wanted to raise a family. And there are, other specialties which may not accommodate for that as much, where you might be on all the time. And so that was a consideration for me when I chose my specific specialty. And then, another thing that people mentioned was sometimes you do have to delay family planning. And this probably applies a little bit more to women than it does to men. But by the time you finish training, a lot of people are like 32 or maybe older. And it can be very difficult to have children, when you're in training. I had my first child during fellowship, but that was extremely difficult and not everyone necessarily wants to do that. And so, sometimes, that is another thing to consider when you're choosing career in medicine. But I will say that taking all that into consideration, I love my job. I love my job because I love talking to people. I love meeting people every day. And I like the fact that I feel I can contribute to their life in a meaningful way, where I feel like I do make things better for them. And for me, that's very, very fulfilling. I think that's everything I had to say. I didn't know if anybody had any questions.
If anyone has any questions, then you can send it in the chat. Oh, yeah. Lucas asked, how's the workplace?
How's the workplace? For me, it really depends. There's a lot of variation. I work in a multi-specialty clinic. So what that means is there are specialists in many different fields working in the same office as me. So I sit next to like 2 endocrinologists and then like down the hall are, 2 primary care providers and an allergist and 3 gastroenterologists. And so a lot of us share patients and there's a, really great camaraderie between us. Because, maybe a lady who's seeing the endocrinologist for diabetes also has sleep apnea. So they're seeing me for sleep apnea. And so I really enjoy that part of my clinic. And then I also work at a long-term acute care facility, which is basically where people are on ventilators. And our job at the facility is to get people off the ventilator. And so I do both like inpatient, like hospital work, as well as intensive care unit work there. And I like the fact that there's kind of very variety. I'm not in clinic all the time and I'm not in the hospital all the time, but I'm a little bit of both. So I don't know if you had like other specific questions about the workplace or not.
If anyone else has any questions, then of course you can send it in the chat. But of course, if you have any questions after that, then feel free to email it to us. And so thank you very much, Dr. Soo, for sharing your experience in the medical field. And I also thank you. Oh, And Lucas has one more question. Is it difficult to see patients suffering in the ICU?
That's so that's a very difficult question to answer. Obviously, in the ICU, we see a lot of end of life, because we're seeing the sickest patients in the entire hospital. I think that when I first started, it was very difficult, because it's very difficult to see people die. And, but I think that how I think about it is, if they do die, did I do everything that I could have done to prevent that? Or did I do everything that I could have done to alleviate their suffering if they had suffering? And, sometimes in the ICU, kind of depending on how things are going, sometimes, there are patients that die when we are doing everything we do to keep them alive. And then sometimes there are patients that, you realize that they're dying and there's nothing you can do to prevent their death. And in those circumstances, sometimes we talk to the patient or we talk to the family about, their end of life choices and, what they may or may not want to do in the remaining time that they have. And so, so that's another aspect of intensive care medicine that I think is very important, where like when you realize someone has limited time, even if you do everything you can, what can you do to make the remainder of their time meaningful? So I guess, it's difficult, but at the end of the day, I can say, I feel like I did everything I could to make, their suffering as minimal as possible. And if they pass away, that they got to do the things that they wanted to do.
That was very insightful, as Brianna said. And we'd like to thank you for coming here today. And I also want to thank you for just during this pandemic, just helping save lives during this very tumultuous time. So yeah, thank you for coming today.
Yeah, it was my pleasure. And I'm really honored that you guys invited me. So thank you so much.
Thank you for sharing your experience in the medical field. Now I will pass it on to Brianna, who will share some important resources regarding cancer support for youth.
Yes, thank you again, Dr. Soo. That was very informative. Evan, would you be able to share your screen? All right, perfect. Thank you. So one of our youth ambassadors named Emily Chang and I created a brochure with some youth cancer support resources. You can use your phone camera again to scan the QR code in the top right, and I will put the link below. And here you can find resources and commonly asked questions about how to support individuals battling youth cancer, along with possible helpful information for individuals battling cancer. And now I'll pass it on back to Clara, who will discuss ways you can get involved in the ACS Youth Ambassador Program.
All right, thank you, Brianna. So now I'd like to talk about this. So right now, thousands of patients with blood cancers like leukemia, lymphoma, sickle cell anemia, or other life-threatening diseases depend on the Be the Match registry to find a match to save their life. Patients need donors who are genetic match. So anyone over 18, please consider registering to save lives. And we will be posting the link in the chat box. Also, every 2 seconds, someone in the US needs blood. It is essential for surgeries, cancer treatment, chronic illnesses, and traumatic injuries. Whether a patient receives whole blood, red cells, platelets, or plasma, this life-saving care starts with one person making a generous donation. Tomorrow, City of Hope is hosting a blood drive from 9 a.m. to 3 p.m. They are urgently in need of type O blood donors. $40 gift card promotion will be given. Please, anyone over 16, please check out the details. Again, we're posting the link in the chat box. Next slide, please. So as we're nearing the end of our conference, I'd like to share some methods of getting involved with the mission of cancer awareness and prevention. These include actively participating, volunteering, leadership training, fundraising, subscribing, and promoting. So Great. So I'd like to encourage you all to join the American Cancer Society Youth Ambassador Program. It's a very unique experience, and overall, I'd really encourage you, to those who are just listening right now, to join this program, because on Sunday, October 10th at 3 p.m., we're going to have an orientation meeting. For anyone who would like to join or explore these opportunities, they can email acsforchange@gmail.com. I'll post it in the chat right now. Another one of the methods of getting involved was fundraising and donating. So we'd like to encourage you all to donate to ACS to contribute to our mission of cancer awareness and prevention. And finally, thank you to our many generous guest speakers, supporters, and to all who attended. We'd like you all to complete a survey in order for us to receive feedback about this conference. We encourage you all to do so, because if you do so, it'll enter you in a very, very special raffle. Very exciting, I know. And we'd also like to thank the Youth Committee and advisors for their efforts to making this event a success. Once again, thank you all who contributed to the second annual Youth Health Conference. And as always, stay healthy and safe.
Thank you very much. Thank you everybody for joining us.
Yeah, thank you so much.
Hi everyone. So there is a event video. I think like Evan, can you share the video?
Sure. Let me try to get that up.
Thank you, Evan. Thank you, Karen. Thank you, everyone, for joining us today, and hope to see you on October 10 at 3 o'clock.
Yeah, we hope to see more.